Thank you so much for a wonderful session. And now we would like to move on to our next session, which is titled as The Need for Innovative Approaches to Enhance Health Data Literacy by Professor Subtin Sarvathikari. Professor Subtain is health informatics educationist and independent consultant for digital health standards with a basic training as a medical doctor from University of Calcutta. He's also done his PhD in biomedical engineering from IIT Varanasi. He's included in the roster of experts for digital health of the World Health Organization. He's a fellow at International Academy of Health Sciences Informatics. Formerly, he was Dean Academics and Student Affairs and professor at IIHMR Delhi. Previously, he was also leading a project of the Ministry of Health and Family Welfare, Government of India, as the first project director for the Center for Health Informatics of the National Health Portal. He is a founder member of HL7 FHIR Foundation and has been an expert advisor for the ELAG e-learning advisory group of SNOMED CT. He is founder director of Subtain Institute. He is a member of the Board of Governors, Commonwealth University College of Medicine, St. Lucia. He is an IMA honorary professor, distinguished fellow at HITLAB, and faculty of PSG FAMA. Please welcome Professor Subtain. Yes.
Okay, so my topic is on the need for innovative approaches to enhance health data literacy. Now, I think all of you are very familiar how data is converted or value added into information that is further processed or value added into knowledge. And finally, we get wisdom. But we can reach wisdom or even the knowledge stage only if the data is correct. So data literacy is nothing but the ability to collect, manage, evaluate, and apply data in a critical manner. Here, the keyword is critical manner. And another definition, it is to read, work with, analyze, and argue with data. When it's applied to health or healthcare, we call it health data literacy. So essentially is you need to be very sure whether the data that you are working with is really the data you need or will give you the results that you are looking for. Digital literacy is obviously, again, using the digital tools judiciously. So now we are getting into the digital health world. Thanks to the COVID-19 pandemic, this has been accelerated quite a lot, and adoption is now widespread, much more than it was 2 years back. So digital health literacy is becoming an essential component to utilize the digital healthcare data and transforming into actionable information, which can give rise to information-based health policy making. Now, I'll just give an example. I mean, what do I mean by this good or appropriate health data? Now, suppose you want to map the growth of a child, whether the child is growing as it should. And if you decide that the data you are going to use is the head, hair form, and pattern, will that be really useful? Absolutely not, because that varies due to various factors and in no way reflects the growth. So whether the head, hair form, and pattern is very attractive or beautiful to look at or not, does not really reflect whether the child is growing properly, like the height or the weight will reflect. So this is something which we need to keep in mind. Whatever we are trying to find, any health information we are trying to find, any health information we are trying to convert into knowledge, we have to be very careful about the data we are looking at. And it so happens that often we come across definitions which have been going on for years, unquestioningly. And that is a problem. Why is a problem? Because somehow or other we tend to go whatever has been told. We rarely question. And unless we are trained to unlearn, we are never going to get to know the real data. Again, I'll give a very relevant example from the current ongoing pandemic. Essentially, if we talk about unlearning. What is unlearning? It is the ability to choose an alternative mental model. When we learn, we add new knowledge to what we already know. And when we unlearn, we step outside the mental model to choose a different one. So the example that I was talking of is here. When we talk about airborne transmission, and this came up again and again during this COVID-19 pandemic, whether this COVID-19 or the SARS-CoV-2 spread through droplet infection or not. So initially there was some confusion because what was being told and what was being seen, they were not matching. But then no one thought of questioning the very basis of what is a droplet. And a very interesting thing happened. So some people decided to look into it. As you can see in this paper, this Tang, Mar, Lee, Stefani, they came out with this paper, this editorial in BMJ, where they redefined the airborne transmission. So what is really a droplet and what is not? So how is it being transmitted if it's not being transmitted as a droplet? Conventionally, when we talk about droplet, usually we think something that goes only if someone coughs or sneezes, it will reach there. But it's not like that. And that is what all this research pointed to. This was a very nice investigative effort, a very commendable effort, and a great example of unlearning, which happened in recent times, and it changed the definition of droplet infection, the definition which had been there for more than 50 years. It got changed because what we believed to be droplets were not really droplets. So I think that is important. So to know data, to question the data, to critically evaluate the data. So if we were thinking that an infection can be spread by droplets, and we are not certain what does a droplet really mean, or we have been wrongly defining a droplet, then it can have severe repercussions, as we saw during the initial phases of the pandemic. So this, I think, really brings in the topic which we are talking about, innovativeness. You have to be innovative. You have to think out of the box in the sense that you have to question, you have to critically evaluate, and you have to unlearn. You may have to critically evaluate or question the data, the definitions of the data which are being used, to be absolutely certain that what is happening is as it should. Now, when we talk about data literacy is actually you can say it's more of a nucleus, but it would not function properly if it stays only there. As you can see, that also brings in a lot of, we have talked about digital literacy, but we also need information literacy, media literacy, scientific literacy, statistical literacy, computational literacy. And all these are related with even social media, the cultural competence, whatever knowledge base we have already had, and scientific method, critical thinking, statistical reasoning, creation, communication, and of course, another thing which is not often looked at is ethics. Because whenever we are talking about generating new knowledge and applying the new knowledge, making new policies, whether it is always ethical or not, whether there's a racial bias. In fact, it has been seen that there have been lots of questions regarding the racial bias of almost anything and everything. In fact, if you look at personalized medicine or individualized medicine, they're both nature and nurture. what is there in your genes and the environmental factors all together make the action of any one particular medicine very different on two individuals who may be related by blood or who may be living in the same place, but still the same medicine doesn't act exactly the same way, even with the same infection in two individuals. So when we are talking about data literacy, health data literacy, or digital health literacy, we have to keep in mind all these things. And that's why I repeat, I mean, why do we really need to have innovative approaches? The examples that I gave, I mean, which data is really useful so that we can make a good decision, a useful decision, a decision that will be more beneficial than harmful. Those are all the critical questions, but the critical questions all rely on data, the data we are working on. We are all very fascinated by the predictive modeling and so on. But modeling is also based on data and some assumptions. So if the data is not of good quality, if the assumptions are not questioned, then we may build some models which would be entirely incorrect, entirely off the track. And that also we have seen during this ongoing pandemic, that there have been so many models which have predicted so many things, and none of those came true. None of the models worked well. Why? Again, the same thing. The problem was at the input level, at the health data level, because either we were not literate enough for the data, so we didn't collect the right data, or even if we collected the right data, we were defining it in some way which was not actually what should have been. Like the example I gave of droplets. So the definition of droplet itself was questionable. In fact, it was questioned and found out that it was built on an assumption which is not correct. And that's why the whole paradigm of airborne transmission is now changed. So the medicine books have to be rewritten when we talk about airborne diseases and droplet transmission. Now we know better, because we had been following something which was not critically evaluated earlier, which was not questioned earlier. So we had wrong droplets being brought into the equation of airborne transmission. And that led to probably more complications, more number of cases, more severe diseases in the initial stages. So I hope I've been able to impress upon the necessity for health data literacy and digital health literacy, and why we need to be innovative, why we need to be very critical in our approach. So what would be the key points or the take-home messages? And we can have more discussions through the question and answer. So this is effectively my last slide. Health data literacy is essential to understand which data is necessary for analyzing and reaching the proper decisions. And once we have the data properly, once we analyze it, try to get insights, then data visualization, user experience, those things also make a difference. Healthcare data models have to be used judiciously. As I said, because if the data on which, or the information on which the model has been processed is not up to the mark, or we don't know whether it is correct or not, then the models are not likely to be useful. So obviously, healthcare data quality has to be ensured, and quality has to be ensured all along the health information cycle, right from the definition, collection, then the processing, the analysis, then the presentation, the interpretation, and of course the use of it. So that quality has to be maintained across all the levels of the health information cycle. And obviously the governance has to be facilitatory. Data sharing would be a very, very important thing, because if we keep everything to ourselves, it could be a problem. Sometimes, of course, data sharing itself can lead to various problems. In fact, we are right now having the variant of concern, the Omicron variant. Probably whether they should have shared or not, that has become a logistical issue now. So governance, and here the governance is global because the disease is global. It's not a localized one. It's very important. for various common healthcare problems, actually, there are analytical solutions which are possible. And of course, as I said through the examples, the innovative approaches are absolutely required to enhance the health data literacy. We have to be aware to be critically evaluating. We have to be ready to question. Just because something is there, some definition is there, or some data is collected traditionally or conventionally, that doesn't mean that that's really what should have been done. So I think that brings to the end of my talk, and I'll stop sharing. If you have any questions, I'd be happy to answer. Thank you.
Thank you so much, Professor Subtin. We have one question from the audience. So the question is, when the NDHM is on its way out, how do you see countries like India can improve its data literacy and interoperability to leverage the power of data to improve health outcomes?
That's a very pertinent question on the backdrop of India. By the way, now the National Digital Health Mission, or the NDHM, has been renamed as the ABDM, the Ayushman Bharat Digital Mission. So the Ayushman Bharat Digital Mission, or the ABDM, is rolling out in a massive scale. Like one of the things that's being rolled out by the National Health Authority, we have seen they have done this COVID platform is also maintained by them. So where the vaccination for COVID-19 has been maintained, it's been streamlined quite well. So anywhere in India, everything comes into the central portal. So the things which are known, definitely that can be done well. But the basic thing which my talk was about is we are actually not even aware what we need. So health data literacy is sadly lacking among the healthcare professionals as well. It's not just the common people don't know. So the first thing is needed is to grow an awareness, and I think programs like this can do that. Next step would obviously be to the people to make sure that everyone is given some training, some sort of education training. There would be probably refresher training courses required to make people understand that health data literacy is extremely important. And we have to be digital health literate. Otherwise, whatever we roll out right now, few years later, we'll come to see that it's useless. And then maybe we are back to square one and we have to start from scratch. I think we need not do that. So the second part of the question was interoperability. And I think the Ministry of Health and Family Welfare did a splendid job when they brought out the recommended standards for electronic health records. The first edition came out in August 2013. And the second edition came out in December 2016. And then we got the excellent document, the National Digital Health Blueprint, that came out 2 years back in November 2019. And the National Digital Health Blueprint recommends all these standards which are mentioned in the EHS Standards 2016 edition. Additionally, the HL7 FHIR Release 4 has been added. And FHIR-based open APIs are being used for data exchange. In fact, in the ABDM, there's the sandbox, and many of the health IT vendors have been also experimenting there. So I think anyone who wants to see how it works or wants to add their own innovations, please go ahead and test on the sandbox, the ABDM sandbox. I think it will be sandbox.abdm.gov.in. So you can just go there, register, play with it, and see to it. So definitely the answer is awareness is needed, and it has to be incorporated in the education of health professionals, all levels, health professionals of all cadres, not just in the healthcare. I mean, those are from health sciences background, but also from the IT background, also from the management background. Everyone should be health data literate, definitely. And also, as I said, for the standards, I think the standards which are recommended in the National Digital Health Blueprint should be incorporated right from the beginning. Otherwise, what will happen later on, we again have to work with the legacy systems, and that itself is a big problem. So I think we have some standards recommended, and it's ideal that we start with standards, whatever systems we develop, however small it may be, but it should be compliant to the standards, whichever standard is applicable for that system. So that is, I think, the way to go. So both training, capacity building of the human resources, as well as implementation using compliant, standards compliant software. I think these are the two things that need to be done.
Thank you for responding to that question. There's another one which says, who should be the key stakeholders to lead the wave of promoting the health data literacy, and what sort of collaborations are required?
Actually, if you look at the health professional education, in fact, for the medical education, we had the erstwhile MCI. Then now we have the National Medical Commission. In fact, they brought out a very detailed curriculum for competency-based medical education, of which one of the goals of an Indian medical graduate is to be leader in data management, health data collection, analysis, and use. Of course, unfortunately, there's no details given there, but I think that's something which, as I said earlier also in the previous question, that we definitely need to have a course on health data literacy for health professional education at all levels, all sorts of health professional education, because this is something, it's a very basic thing. It's as basic as the alphabets. Unless you know what data you're going to work with, how to know that data is the correct one, you really cannot give the desired output. So ideally the regulators, because in our country, it's the national commissions who are giving the guidelines, I mean, how the curriculum should be. And that's how it is followed. And obviously the teachers have to be trained, because if the teachers themselves are not aware what is it. So training the trainers, that's important. And then, as I said, at all level, it has to be done. And the most important stakeholders, I think, would be all the health professional education institutes.
Thank you so much. So we don't have any more questions. And is there anything that you would like to say before you?
No, so if anyone has got any questions, in fact, you're most free to send it later, and you can email me. I can respond to it. And in fact, if you're putting up somewhere in as a newsletter or blog also, we can, because I think this is a very important topic, and this is hardly touched upon by many speakers or even the policymakers, because I think the policymakers also need to know about it. So I think this is an extremely important topic. So I think I leave it up to you how best you think you can make it known to people who matter.
Sure, it is through speakers like you that we are able to help spread the word. And thank you so much.
Okay, bye.
Bye bye.